Hey, how you doing?
Doing another Friday.
Yes, another Friday. These 2 years have flown by. So let's start off with the rules are now set for the conservative leadership race. The question is, do you have $200,000?
Well, I've got no announcement to make today. If that's what you're wondering, I'm going to look at the rules and um, talk to my family and friends and Brampton residents. But those rules only came out the other night, so it's still pretty early.
Okay. Can I ask you a question? What happens in a case like this? Do you have to step down if you decide to go, or what happens?
Well, I certainly haven't thought of those hypotheticals yet. It's still very early, but I know when Jack later ran for the federal NDP, he continued to serve as a city councillor. When Pete Buttigieg ran for the Democrat nomination, I believe he continued to serve as mayor. I certainly have not made any decisions, and my first priority is to make sure I uphold all my duties in Brampton. And continue to make sure that every commitment I made in the last municipal election I'm able to honor. I had a ambitious platform to get Brampton back on track, and I still want to make sure that we achieve every element of that platform.
Okay. Council this week, Brampton City Council voted this week to halt the Brampton University because the Integrity Commissioner had to look at some, connections with Councillor Santos in, certain consultation fees. How do you explain to Brampton the 600K, that kind of is questionable?
So first of all, Councillor Santos, before she recommended individuals to the city to help on the project, got it cleared with the Integrity Commissioner in 2019. So that work was done in advance, so I'm not sure why it would need to be verified again. I believe the Integrity Commissioner at the time said if you have good people you can recommend to the city from your previous work experiences, then absolutely, you should bring good names forward. In terms of Brampton U, I want our city to be ambitious. For too often we've accepted getting less. I know some people are, have accepted the fact we're not going to get our own university. That's never been my approach. And frankly, this is not new to this council. They spent a similar amount during the previous city council with the Blue Ribbon panel, pushing for a satellite Ryerson campus. I am never going to accept that a city the size of Brampton doesn't have our own university. And, the lobbying that we have done has been successful. This has not been for naught. Brampton got rejected 4 years ago. The Ryerson campus got canceled. We had nothing. And because we made such a stink and because we lobbied so aggressively, at least they come to the table. And now we've got Algoma University with an exciting computer science program, an aviation program. They're expanding. The Premier told me we're getting a med school, which was announced in the last provincial budget. We have Guelph Humber in talks with the city about a major campus in the downtown. And so I think by pushing the envelope and saying we're not going to accept their rejection of Ryerson, it's really pushed the province to a position they're trying to offer us alternatives. And so I'm a big believer that we should never accept less. And, right now, the province is saying instead of a Brampton U, we're going to get a med school and potentially a Guelph Humber campus. And I'll take those, but I'm still, I'm still going to be determined to see a university. We're the only big city in Canada that doesn't have our own university. So, I will take their med school. I will take whatever satellite campus they will give us. But as long as I'm, the advocate for Brampton, I will be pushing for more.
Are you disappointed that council voted to kind of put a stop to this for now until the Integrity Commissioner kind of looks at it?
So the way I viewed the motion, it was just to put a pause on any spending related to Brampton University. That doesn't prevent members of council to continue to advocate for the need for more post-secondary education investments. And frankly, the spending on Brampton U was paused, I believe, almost a year ago anyways. And so I didn't see this as anything new. And if they want to get a second opinion on the first Integrity Commissioner ruling about Councillor Santos, then I suspect the second ruling will be the same as the first ruling. If members of council have good people they can bring to the table to help out on a cause dear to the city, they should bring those names forward.
Cool. This week, while on your presser, you said can't live in fear. Then you got kind of destroyed on Twitter by doctors and stuff. Do you regret saying that? And what do you mean by that?
Well, actually, I saw a lot of support on social media from physicians. And the comment that I read was from, in my press conference, I read a quote from the top infectious disease doctor at Osler. And the person that attacked that comment wasn't a doctor. It was a lobbyist in the name of Anthony Dale. I'm going to trust our doctors. I'm going to trust people like Sergio Barada. I'm going to trust those that deal with infectious diseases. I'm going to trust Dr. Lowe. Dr. Lowe's comments at the press conference that he believed the conditions were now reaching the point where we weren't going to need to extend our mask mandate when it expires in March. What's interesting, Khalid, is that when lockdowns were being brought on and restrictions were being introduced, everyone said, listen to the science, listen to the data, listen to the doctors. Now that restrictions are being lifted, the same critics are saying, don't listen to the science, don't listen to the data, don't listen to the doctors. I trust Dr. Lowe, I trust Dr. Baraja, I trust our top doctors in Peel. And when they say they're comfortable with restrictions being lifted, then I am too. I worried that, I went to a restaurant to watch a sporting event, a local pub, and it was empty. And it made me sad because there's still a level of fear out there. I've seen people walk down the street by themselves wearing a mask when the data suggests that is completely unnecessary. I want our residents to be armed with all the top medical advice, all the top science, all the top data, so they can make informed decisions. And I think over the last 2 years, a lot of fear has built up. And so, I shared a comment that Dr. Lowe had made that I thought was instructive. And he said at the beginning of the pandemic, the severity of COVID-19 was catastrophic. The beginning of the pandemic, there was such high numbers of COVID-19 that could overwhelm our hospital system. But right now, because of the sacrifices that all of you have made, because of the high vaccination rates and the latest variant, it's only 2 times more dangerous than the flu. And so we went from something that was a massive burden on the healthcare system to one that we can manage with the tools that we now have. And so rather than unfairly inflame fear in the community, I'm trying to arm the community with the same information that our top infectious disease doctor at Osler provides to me, that our medical officer health provides to me. It's why I've held town halls throughout the pandemic. I want to be as transparent as possible and make sure the information that I get briefed on as a community leader, the public has as well. And when I found out there was inaccurate data with hospital reporting, I shared it with the public, when half the cases were incidental. And I'm going to add one last thing, Khalid. I came out strongly with Dr. Lowe in January and said children should be back in school. I felt it was important that we have children in school learning. And there was huge mental health consequences. There was a societal consequence for children falling behind in their academic growth. And at the time, they seemed critics were ferocious on social media, saying that this lockdown crowd was saying, now, how dare Mayor Brown say this? He's not a doctor. Hospital cases are going to skyrocket if kids go back to school. Kids went back to school and hospital cases didn't skyrocket. We've seen almost 0 severe cases amongst children. We've seen hospital levels, actually we've seen cases decline to some of the lowest levels we've seen. We now have hospital capacity at Osler that is better than it was before the pandemic, before the first case. And so I'm going to continue to speak with honesty and transparency to the public, and I will not be intimidated to tell the truth because some lobbyist will attack me on Twitter.
Is Dr. Lowe going to be at your pressers, or is he retiring from the pressers in Brampton as well?
So Dr. Lowe has said he now believes we're at a point where the pandemic has turned to an endemic and that weekly updates are no longer necessary. He said if some reason we get a new variant that changes the dynamic, he will he'll come back. But he said it's a very good thing that he doesn't need to update us every week, because that means we can put COVID-19 in the rearview mirror. And so as I left him on Wednesday, I said, I look forward to not seeing you. Because if I see him, it means the situation's got worse.
True. And last thing, Toronto announced all summer events are back. Pride, Caravana, everything's back in Toronto. Is everything coming back in Brampton, summer events?
100%. There's no reason to have any events canceled. The province is lifting all restrictions, and so I expect us to have a normal summer where the community can be active and enjoy beautiful Brampton again.
Nice. All right, Mayor, thank you so much. That's all I have.
Okay.
Have
All
a
the
good
best.
weekend. Okay.